do a sterile wound dressing change, you would first review your orders, obtain your supplies. You would then go into your patient's room, you would introduce yourself and wash your hands. You would identify your patient in 2 ways. You would make sure they didn't have any allergies. You would walk through the procedure with them, answer any questions they had. You would then raise the bed up for proper biomechanics. You would ask friends and family to leave for privacy, and you'd make sure you had enough lighting. To start changing the soil dressing, you'd start by donning your protective gear. Then you get your mask. We'll don non-sterile gloves. And I'm ready. I then assess my patient. I make sure she's in a comfortable position with the wound easy to assess. I have already washed and donned my non-sterile gloves. So then I put a waterproof pad on each side of my patient, making sure to catch the extra drainage. I then take off the old tape. I make sure and hold that skin really taut. And remove the tape. And I remove the dressing and make sure and evaluate if the fluid, the color, the odor, and the amount. Also do it on these. Assess the amount of the drainage and the type and color, as well as on these. And I put those in a biohazard bag. I would then open my 4x4s. I just put the normal saline solution on and soak the 4x4s. I then wash my hands, and then don new non-sterile gloves. I would then start by grabbing a 4x4, using a new one each time. I'd be assessing the sutures or the staples. This is a new 4x4 since I ran out. I then grab another 4x4, clean one. I'd assess the staples and assess the sutures for any fluid, extradite, tissue, color, amount, odor, and size. To obtain a wound culture, I'd take my culturette, I would remove the lid, I would take my Q-tip, make sure to get all the fluid, and make sure that Q-tip is fully saturated. I then stick it back in my culture tube, close it, label it appropriately, and then put it in a biohazard bag. Make sure my lab orders go in the front and take it to lab. Then I would remove my non-sterile gloves and wash my hands. To start my dry sterile dressing, I would open my packages, then I would don my sterile gloves. I'd apply my gauze over the wound. Then I would take my abdominal pad and place that over just to cover it. And I would take my tape. I would secure it. And since my port, I will then drain the fluid. I would unpin this from the patient's gown. I'd open the drainage port. I'd pour it into my measuring basin. I'd take my alcohol swab, and then I would swab it out into the air, close the device, repin it to the patient's gown. I would discard of the fluid appropriately and document it. Then I would cover, since my drainage port's already cleaned, I'd cover it. And I'd have done this first before I removed the drainage. And I would secure it. And then I would have lowered the bed. Remove my gloves, wash my hands, discard of all my stuff appropriately, and make sure to return patient to a comfortable position and safety. Make sure their call light is within reach. I'd make sure their table is within reach in the call light, and then I would make sure they're comfortable, the light's where they want it. If they want their family back, I'd make sure that, and then I would document my findings and my procedures.